All right, so good morning, good afternoon. Welcome to the last town hall of the year. I'm Sherry Cohen, a member of the Learning and Development team and one of the 3 organization development specialists at RHD. So I want to start by wishing you and your families a healthy and safe holiday season. I also want to take this moment to express my sincere gratitude to all of you who are serving so selflessly during the pandemic. It's been a long journey and a journey we're not at the end of yet. So our leadership team will not be joining us today, and I have been asked to make the opening remarks. And I'm having a little technical difficulty here. Okay. So truthfully, I have to tell you, I've been thinking about this for about a week, Googling for inspirational ideals. For those that know me, I love to do a lot of research, and I got to say, I came up empty-handed. So I decided to put my organization development hat on and share an approach for pandemic life through that lens. And that is going to be to move into a learning space. So for example, I ask myself regularly, what am I learning from these challenging times, personally and professionally? How will I alter my work? How will I show up in the world differently? I actually have a theory. We should be asking ourselves every day, just like we would a small child, what did I learn today, this week, this month, this year? So we're all learning all the time, but it's in the reflection that we unpack the learning and make meaning. So one example I want to give that comes to mind for me is the language of social or being socially distant. I don't feel socially distant. In fact, I would say I feel socially closer to many people. So the language I use in my mind is being physically distant when I'm with people I don't know. So that's sort of one of those little things that I've unpacked for myself. So I know that this won't resonate for everyone. Certainly we have to be in a safe space to really feel like we have the wherewithal for real reflection. But I did want to offer something of use for this moment. So with that, I'm going to turn it over to myself for housekeeping. So Mary, if you could bring up the agenda, please. Thanks, Mary. So opening remarks, check. Housekeeping, just a couple things as a reminder. This is the last town hall. Our next town hall will take place on January 10th. I'm sure if there's some information that needs to come out sooner, we will get that to you via email and your leaders. I also want to remind folks that you can donate your PTO. For that information, if you go to Lawson, you can get to the COVID-19 website. And on that website, you can click through to the form to donate the PTO. So I just want to encourage, as we approach the end of the year, for folks to donate their PTO. We have COVID Corner today, so I know I'm looking forward to what Brian has in store for us. And then we have our own Nina Morell. Nina's from FPCN. And she's going to be sharing some COVID-19 information with us today. And of course, then we'll move into a Q&A. And Pam Pam, I knew I was going to kill your last name. Okay, Pam will be giving us our closing remarks today. And I'll let her properly pronounce her last name. All right, so Brian, I am going to pass it to you for the COVID Corner.
All right. Oops. Hold on, everybody. Having a bit of technical difficulty. And there we go. Hi, RHD. It's me, your elf on the shelf.
Okay.
Your elf on the shelf, Winter's Breath. I'm back from the North Pole to watch over you and see who's being naughty or nice, and also COVID safe. A whole year has gone and passed away, but I haven't been very far away. And now I'll be back every day to keep my eye on you and check up on you. So I'm here today to tell you not to get snowed by misinformation. Here's some holiday guidance by risk level when it comes to celebrating safely. So low risk, if you're fully vaccinated, gather in small groups with those who are also fully vaccinated and choose virtual reindeer games and events. So moderate risk, if you are fully vaccinated, have a small outdoor gathering with friends and family who are of mixed vaccination status and wear a mask. Hey, we can build snowmen, right? And high risk. If you're not vaccinated, don't gather with other people from outside of your household who are also not vaccinated. Remember, Krampus is also watching. Be like my good friend Dobby and avoid crowded, poorly ventilated spaces. And if you're going to gather, do it outdoors. It's much safer. And if you're sick or have symptoms, don't host or attend a holiday gathering. Now, don't be a bumbles. COVID response needs to be layered, just like a beautiful snowfall. Just observing one safe behavior isn't enough. Even if you're vaccinated, it's not a 100% guarantee that you won't become ill. So you need to layer in your other protective measures like washing your hands, watching your distance, waiting on large gatherings with mixed vaccination status friends or family, and wearing a mask regardless of your vaccination status. I know everybody's concerned about the Omicron variant, so we should really be safe this year. And one last thing I have for you. I brought a really good friend of mine to help spread the COVID safety message. It's Olaf from Frozen. Wait, what? But Olaf isn't here. Wait, what? He said something about copyright infringement and not wanting to hear from the Disney lawyers? Oh, okay. But he did pass on a COVID safety message. He said what? Don't let it go. And on that note, let's make this a healthy and safe holiday season. Thank you, everybody. Be safe.
Thank you. That was fantastic. All right, Nina, I think you are on, and I am going to pass it over to you to share some information around COVID.
Hello, everyone. Hope everybody's doing fine and staying safe. I'm in my vehicle right now. I had to come out to Conshohocken for some FPCM business, but I'm here with you all. So just wanted to give a little bit of information just about how to stay safe and about variants. So the virus that causes COVID-19 is constantly changing. Every time you turn on the news, it seems like there's a new variant out there. So that's because the longer a virus is circulating in the general public, the more new variants are expected to develop. Sometimes these variants emerge and disappear. Sometimes they cause a lot of havoc before they disappear. Sometimes the virus will just die off. But as the virus spreads, it has new opportunities to change and become more difficult to stop. So like most living things, it wants to survive. And viruses survive by adapting and changing. And that's why we have so many different variants. The reason why when Omicron or any new variant comes out, like we're hearing about it and the CDC and everybody's jumping on it, is because we don't know what kind of damage that new variant may or may not cause. So the government is being hyper vigilant just to make sure that this is not the one that's going to cause, the most devastation. So despite the increased attention of Omicron, Delta continues to be the main variant circulating in the United States currently. We know very little currently about Omicron. We do know that it spreads very easily compared to Delta. But what we don't know is, whether or not it causes more disease or not. So far, it appears to cause mild symptoms, but they're still investigating how much damage it actually causes. So if you've been tested recently, you may see that your tests are coming back slower, may not come back as fast from the lab, and that's because the labs are doing surveillance on the new positive specimens just to make sure that it's not Omicron or some new variant. So what we do know, vaccines protect against the spread of COVID-19. Vaccines also help to prevent severe illness and hospitalizations due to infection from Delta and also Omicron variant. We have seen an uptick in people who are fully vaccinated have positive COVID results. However, these people have mild symptoms. Hospitalization and severe illness still remains higher amongst people who are not vaccinated. So what's the recommendation? The recommendation is to get vaccinated. If you're fully vaccinated and it's been 6 months, you should get your booster shot. Vaccines work. Also, as Brian stated earlier, washing your hands, keeping your distance, all these things combined help to decrease the spread of COVID-19. Nothing is 100%. I like to use the analogy wearing your seatbelt. We know that wearing your seatbelt decreases the rate of death if you're in a car accident, but it's not 100%. There's only 2 guarantees in life. We're going to die and we're going to pay taxes. But if you wear your seatbelt, you stop at the red light, you obey the laws of driving, you pay attention and not be distracted, you drive the speed limit. All these things together increase your likelihood of survival. So it's the same thing when it comes to COVID-19. Nothing is 100%. However, if you layer all these things together, vaccination, distancing, washing your hands, wearing your mask, and also getting tested. Testing helps to also decrease the rate of spread. That's the reason why we test prior to traveling, to make sure we're not taking it over to a foreign country or people are not bringing it here. And I do recommend if you're going to join family gatherings that you do keep them small. Also, you may want to test prior to joining gatherings, and you also may want to test before you return to work if you're working on site. So that's what I have to say about it. If anybody has any questions.
Thank you, Nina. We will open it up. We'll go right into Q&A. So this way we can direct those to you while we have you here. So let me check in with Mary and Sarah. Nina, most of our questions come in through the chat. So Mary?
Yeah, I guess a quick follow-up for Nina. Someone's asking if that includes fully vaccinated being tested.
Yes. Yes, I would recommend that fully vaccinated people get tested too. I'm fully vaccinated. Well, fully vaccinated just means that you have both shots, right? The first primary series, if you got Pfizer or Moderna, and 1 shot for the J&J. I would definitely want to be tested prior to joining, especially if it's been longer than 6 months since you completed your first series.
Okay, thank you. And then the other question I saw is a follow-up for Brian, and someone was just asking if you could clarify again what you recommend during the holidays if you're fully vaccinated with the booster.
Oh, there we go. I'm back on. I had to get the hat off. It was actually kind of hot. So if you've been fully vaccinated and you have your booster shot, you can gather in small groups with family, with your close family, and then you can also then choose some virtual events. You know, we still recommend that you don't do any large gatherings or anything like that. You still want to keep it small. You want to keep it, you know, just 2 people in your household if possible.
Yeah, if you go out into public spaces, do wear a mask, even if you're fully vaccinated, because as Nina said, there are variants out there, particularly Omicron, which is new, and we're not too sure how that's working right now. But to protect yourself and others, you may be a carrier. You don't want to spread it around either.
Exactly. Thanks, June.
That's it for the chat right now, Sherry, if you want to check in with Sarah.
Yep. Sarah, any questions? You're on mute, Sarah.
You think after 2 years I get a hang of this Zoom thing. I do have a couple of questions. One is about testing, and then the others are about other things that are not COVID related. So the first, will weekly testing be made available If so, are we able to wait until the last minute to get the first shot and then just get tested until we can get the second shot? Sheena, I'm not sure, maybe it would be helpful for you to answer this.
Yeah.
I'm not exactly sure what they mean by wait till the last minute to get the first
Yeah,
shot. But
I'm not sure. I'm going to assume this is not specifying the Philadelphia area actually, because in
It didn't.
Philadelphia, if you're not fully vaccinated and don't have an exemption, you cannot work right now. So I'm going to assume this is maybe for the rest of the country, and maybe it's regarding the CMS mandate, perhaps, or the OSHA mandate. So the best thing to do, if you know, if you're required, wherever you're at, if you're required to vaccinate, if there's a vaccination mandate in effect, you know, to comply as soon as possible. You don't want to wait till the last minute with anything, because what we're seeing in a lot of the country is there isn't much availability. So waiting to the last minute doesn't guarantee that you'll be able, you know, to get it on time, to comply and be able to work. I'm not quite sure I fully understood the question. So whoever asked it, if you wanna, you could message my voice again, or you could private message me maybe, just to maybe clarify. If you are in the, put a plug out here, if you are in the Philadelphia area, this applies if you're unvaccinated or vaccinated. We started the on-site testing at 4700 Wissahickon. So this is hopefully a blueprint for something that may be replicated throughout the country. So even though this is specific to the Philadelphia area or those who have access to get to this office, we are using this as a pilot for what may be done across the country. So just throwing that out there. So if you have any questions about testing at 4700, it's open to employees, vaccinated, not vaccinated, come in, get tested. It's free of charge. I would highly recommend doing it, like Nina and Brian said, before the before gathering for the holidays.
thanks, Sheena. Yeah, it came through your voice, so it was anonymous, but hopefully that person will do a follow-up so that we can clarify. I'm just gonna, go ahead.
Hey, Sheena, on the testing, what is the time period for results?
So
When
the
are they?
results are 12 to 36 hours. I could give you some examples. I got tested. We did a run through last week. I got tested on Wednesday around noon. I got my results back Thursday around 10 p.m. So if that gives an example for how quickly the results are coming back.
Thank
I'm gonna move to the questions that are in the chat so that we can continue with the COVID related questions. Someone asked where we can get exemption forms, where staff can find exemption forms. You can find those forms on Okta. And you know, just go through the process and fill it out. There are instructions too. Someone also asked, does FPCN still have capacity to come out to programs to test clients? Sheena or Nina, I'm assuming, probably could answer that.
Nina, she's still on.
And Nina's still on. Nina, you're on mute if you're trying to answer that question. Yeah, thank
There you go.
Hi, yes. We do not have the capacity right now to do community testing. There's more to come on testing. HRSA actually has a program where they want to try to get at-home testing out to the community. So there's more to come on that. I don't have a lot of information that I can give, but the government is interested in moving to more at-home rapid testing. So we may be able to get some rapid testing kits in the next few weeks. So I can give you more information about that when I know more, but we do not have the capacity to do it only because of staffing. We're having a lot of staffing shortages. And we have a limited schedule currently within the clinic that you have to call in to actually get on a schedule to do testing.
And I just want to follow up with just a quick blurb. So currently, and we all know this is a fluid situation, currently RHD is not accepting at-home tests. So if you're in the Philadelphia area, there are some at-home tests that are going to be given out in different locations. I'm sure in other places across the country, they may be doing that as well. So for unrelated work purposes, they're great. If you get a hold of that before holiday functions and want to take that at home, that's great. But for RHD purposes, we are not accepting at-home tests right now.
I'm going to keep asking questions from the chat if that's okay with everyone. Is there going to be a point when weekly testing is going to be required for all employees, regardless of vaccination status, with Omicron looming? And this is a question from outside of the Philadelphia area.
Let's say if Brian is on, Brian Joel.
I am here. Sheena, can you hear me? So it's hard for us to anticipate what will be implemented or what will be required. However, we do anticipate either one of the federal mandates to impact RHD. So that would, specific to the OSHA mandate, that would require folks to either be vaccinated and or tested if they're unvaccinated. That will be the rule that we know may be on the horizon. In terms of having to be tested, whether vaccinated or unvaccinated, we're not aware of that being implemented, but we certainly monitor to see if the government or the state localities will require that. But right now, we do not anticipate or know of any rule requiring that.
Okay, thank you. And if you've sent me a private message, just know that I'm seeing it. I'm getting a lot right now, so I'm scrolling. Will booster shots be done at 4,700 for those who got their shots done there? I'm assuming that's the FPCN vaccination.
Yeah, I'm gonna assume so.
appointments.
Yeah, so if we did, regardless of if you got shots done at FPCN or there was a time where we actually did a clinic at the corporate, inside of the corporate office. So you can follow up to get your booster shots, you can follow up, like Nina said, call FPCN to schedule an appointment. And you can also reach out to, you don't have to get your booster shot where you got your other series of shots from. So you could also reach out to, other pharmacies or just other entities that are providing booster shots.
So there's someone in the chat asking if someone could speak to the accuracy of rapid testing, I guess, as opposed to the PCR tests. I don't know if Nina, you have any information that you might be able to share about.
I do, and I just looked at this information, and I can't remember the exact number, but it is in like the 90th percentile. The problem is there's a higher rate of false negatives sometimes depending on which at-home test you're using. So repeat testing is often required, like a couple days after the initial at-home test, just to rule out, because it can take a couple days before you develop enough viral particles to be detected by one of those at-home tests, especially in somebody who's asymptomatic. So they do recommend, serial testing if you're using at-home test.
Yeah, and a lot of them have 2 tests per box, so it supports the idea of the serial testing. Sorry. I'm reading a lot of questions. Shoot. think I missed one. Oh, well, I'll come back. I've been hearing that the health department in Philly is offering organizations bulk at-home tests. Do we have anyone who's in contact with them, or should programs reach out to them individually?
So I'm assuming that these are for use for the individuals and not employees. And I would say in response to that, that probably right now it may be best that programs individually reach out. If any programs, for right now, I would say maybe programs individually reach out, but I may follow up with an email to Philadelphia unit directors at some point this week to follow up about that. But right now, I don't want to hold anything up. So I would say, yeah, programs can individually reach out about that. And again, for use for work purposes, employees need to have tests done at a center. They can't use the home rapid testing.
Okay, this is a
Hey,
really
hey,
good.
Sarah, real quick before you go on, June, I'm just wondering if you want to explain the why around they're not accepting at-home testing. That's not an RHD, right? If I understand correctly.
This is an RHD rule. So this is an RHD thing. So this is anywhere where there is a testing mandate in effect. So this goes for Philadelphia, Connecticut, and Delaware. It's the right. And again, this is a very fluid situation. So things may change. A lot of people are putting a lot of really interesting things in the chat that are really great points. So things may change as, this variant is spreading and, new things happen. But for right now, in order to ensure I guess how official it's done, to make sure that it's being done properly and effectively, we're only accepting tests from, actual testing centers. So doctor's office, pharmacies, events that may be happening.
Thanks for clarifying. I clearly missed it.
Some of the
Thank you.
mandates,
And Laura just mentioned, Laura Marble for Delaware. Delaware is not accepting at-home testing per their mandate. So I just
yeah,
wanted
and the
to throw that out.
Philadelphia mandate doesn't either. So that's one of the.
Okay.
Yeah. So
Sorry to
June-
throw us off track there. Sometimes it's nice to know the why. Sorry, Brian, did I interrupt you?
No, I just wanted to respond to June's. My understanding is that the Philadelphia mandate does allow for those tests, but I'm not sure if RHD and Sheena, maybe you can
Yeah,
help me out there.
that's correct. So
Okay.
Delaware does not allow for their mandate. I have to check with Connecticut. Philadelphia does allow for it within their mandate. RHD does not. So again, like
Thank
we've
you.
been saying from the beginning, everything is fluid. So things may change and there may come a point where we do allow for the home test. But as of now, RHD in no state is accepting home tests for employees.
Thank you for that clarity.
All right, back to the Q&A, Sarah. Sorry about that, folks.
All right. Okay, if at-home tests aren't being accepted for clearance for COVID, does that mean we can't accept an at-home test that comes back positive? Would they need to follow up with a regular test to be considered COVID positive? I'm assuming regular, they're referring to the PCR test.
I'm sorry, I'm gonna jump in and I hope Brian is maybe around also. So if someone takes an at-home test, they test positive. Are they saying, oh, since it's an at-home test, I could still work or something like, is that maybe where it's going? So if you have symptoms or you take something where it comes up positive, you need to follow up with another test to confirm, a confirmatory test. So until you get the results back from that confirmatory test, you should be quarantined. You should be following the guidelines from the CDC. So even though RHD, so for example, even though RHD isn't accepting at-home tests for employees for proof of your status, the CDC is still in effect. You know, so their guidelines and protocols are still in effect. Does that make sense? So,
can I just chime in? This is Nina again. I don't think that the at-home test is going to change what we do thus far. I think it's just going to be an additional tool. So if you're symptomatic or you had a recent exposure, you would just follow the protocol as it is now. You would stay home, you would go get tested. So if you do have an at-home test and you test positive, you would still follow those same rules. If you don't feel well, you stay home until you get tested and they prove otherwise. So the at-home testing is not to, you know, get rid of PCR testing. It's just to be used as an additional tool for people, either like prior to gatherings, you can test yourself, you know, before you go back to work after the gathering, you can test yourself if you're asymptomatic to see, you know, if you need to follow up. The important piece is, yes, we're still continuing the same protocol. There should be no major changes to the protocol, just an additional tool.
So there are some more questions about at-home testing. I just saw one pop up. I have several others, but I'm just going to ask this one because I think it's a good follow-up. If the guidelines are being followed by the CDC, then why is this at-home testing not being followed?
I can jump in.
I'm not too sure what that question actually refers to. Because the CDC recommends that the PCR tests be used.
So basically it's, you know, CDC has their guidelines, but RHD could still set their own guidelines and rules around what we will accept and not accept. So ours are more stricter when it comes to this. And that's to try to prevent the spread of COVID. So to prevent, it's like that as a preventative measure.
Thanks,
Yeah,
Jen.
and the mandate is Philadelphia, so that's a regulation.
Sade, what do you mean with the mandate? Oh, is that what June just answered? Okay.
Okay, I'm going to ask a few more questions. Now that the OSHA mandate has been reinstated, are there any updates?
Is that the end of the question, Sarah? I'm sorry.
Yeah, I had asked this earlier, but I can ask it again. If someone is unable to get a second dose before the deadline, can they get weekly tests until the next shot is administered?
So that is right. There's been updates in terms of both the CMS mandate and the OSHA mandate. The CMS mandate, we don't anticipate, although they have reinstated it in certain states, 25 to be exact, it only is applicable to the FPCN program, if you will. The OSHA mandate, which requires employers with 100 plus or more employees to either have their employees vaccinated or go with weekly testing. We do anticipate them to extend the dates for when folks are either required to get vaccinated and or tested. But the unvaccinated time until we know, or the unvaccinated people until we know what those dates are, will be required to mask until we know exactly when the requirements will be for them to be vaccinated and or submit to weekly testing.
Yes, except for Philadelphia, Delaware, and Connecticut, which have additional mandates.
That's exactly right. Thanks, June. So let's not forget, regardless of the federal mandates, states and or localities are allowed to impose stricter requirements, and RHD will be required to adhere to those stricter requirements in addition to the federal mandate as well. Thank you, June.
I'm going to continue asking questions. Will office positions be changing to all remote work again due to an uptick in cases?
There has been no mention of any changes at this time. But as we've talked about today, things do change. So keep inquiring, keep in contact with your supervisor, who should be informing you of any protocols, changes, etc., for our workspace.
Thanks, June. So someone asked, are there any actions that will be taken on staff who come to work knowingly that they have been exposed? So I'm assuming they mean, are there any consequences that will be taken if a staff comes to work knowing that they've been exposed to COVID?
Exposures for COVID still need to be reported. If you come to work and you report that you have been exposed, you're going to be sent home if that is required based on the circumstances, which I don't know because they haven't been detailed here. For example, if you're unvaccinated, you've been exposed, that is has a different set of protocols than if you're vaccinated and have been exposed. So you need to be up on those protocols, but you will be sent home once you report that.
So somebody asked if Binax, I'm assuming that's a brand of rapid test, I think. If Binax is what they use in the clinic, what is the difference in using it at home? I don't know if you're referring to the Philadelphia testing clinic.
So yeah, Binax is a brand of, rapid tests that are used. Right now, it's just our policy. We're not allowing at-home tests to be used as your proof of negative testing status for COVID. Like, it's just the policy we have right now. So it doesn't matter the brand, it doesn't matter. It has to be done at a legitimate testing facility.
I think the point that Sheena's trying to make is that it has to be done by someone who's qualified, who's a clinician, because there is a lot of user error involved in doing these tests. If they're done incorrectly, you can get like false negatives, not really false positives, but a false negative when somebody who's actually positive. So I think it is prudent to allow, professionals to still be able to run the testing and do the testing. And like I said, at home can be more of a tool, additional tool for people to use.
Thanks, Nina and Sheena. Okay. Okay, I believe that I am out of questions. Mary, have you gotten any? Maybe we can go to you and see if you've gotten any.
No, you're really handling the chat, Sarah. So
I'm getting private messages.
yeah, I don't have any.
So I'm just trying to say them all.
Yeah.
I'm trying to include the ones that aren't private too. If I'm missing any, I'm sorry. Yeah, I believe we asked this earlier about testing vaccinated people. I might be wrong because I've asked a lot of questions today and I'm not fully paying attention to the answers because I'm fielding questions. So does anyone want to speak to that question about vaccinated folks I'm assuming it's that right now we don't have that policy, but things could change.
Yeah, Sarah, that's right. So right now, currently, we don't have that policy, nor is it required by any governmental entity. But however, it's going to continuously change as we navigate through this pandemic. So we will advise if that does become the circumstance, but right now, currently, we don't have that requirement.
Thanks, Brian. Sherry, that's all from me.
All right, thank you, Sarah and Mary. I think I've been trying to look. I think we're good to go there. In the chat. I'm gonna look yeah, good to go.
Yep.
All right, so let me pass it to Pam.
Before Pam gets on, can I just make another
Yes,
quick
please.
plug? So
Yeah.
I mentioned this earlier. I'm gonna keep sending emails and keep mentioning this again. For those who are able to access the corporate office in Philadelphia, testing is available here for employees. And again, with the holidays approaching, I think it's highly recommended that vaccinated or not, you get tested. So please take a look at the emails. If you have any questions or unable to schedule, please reach out to me.
Thank you, Sheena. And thank you for getting the testing up and running. I know that was a lot of work, so thank you. All right, Pam, take us home.
Thank you. Whew, that's what I have to say. Thank you, everyone. I'm Pam Kazanet. I am a clinical director in the Behavioral Health and Housing Division and a member of DSIC. And like Sherry, when I was asked to pitch in and close this meeting,
Postmaster.
I was also a little bit at a loss what to say. This is our last meeting. Here we are at the end of 2021. And I think, like so many of you, I thought we would be in a totally different place this time, especially when we think about December 2020 and probably the hope we had with the vaccinations. And there's still so much stress and so much anxiety and so much known out there. And for someone whose part of their job is to sort of help hold spaces for people, I'm a little bit at a loss as well, feeling that. So I decided to look for words of other people to try and help and kind of bring us home and wrap this up. So I'm going to read an excerpt of a poem by Maya Angelou. This isn't the whole poem. These are parts of it that I took out that I think really speak to where we are and maybe a little bit of what we all need right now. Just get it up. And the poem is called Amazing Peace, a Christmas poem by Maya Angelou. Into this climate of fear and apprehension, Christmas enters, streaming lights of joy, ringing bells of hope, and singing carols of forgiveness high up in the bright air. The world is encouraged to come away from rancor, come the way of friendship. Hope is born again in the faces of children. It rides on the shoulders of our aged as they walk into their sunsets. Hope spreads around the earth, brightening all things, even hate, which crouches breeding in dark corridors. We clap our hands and welcome the peace of Christmas. We beckon this good season to wait a while with us. We, Baptist and Buddhist, Methodist and Muslim, say come, peace. Come and fill us and our world with your majesty. We, the Jew and the Jainist, the Catholic and the Confucian, implore you to stay a while with us, so we may learn by your shimmering light how to look beyond complexion and see community. We, angels and mortals, believers and non-believers, look heavenward and speak the word aloud, peace. We look at our world and speak the word aloud, peace. we look at each other, then into ourselves, and we say without shyness or apology or hesitation, peace, my brother, peace, my sister, peace, my soul. So I say to all of you, may you find just a little bit more peace this year. Find some way, big, small, to recharge and refuel a little bit by being with those that you love, by being alone, whatever it is, or some combination of those that kind of makes you feel more grounded in your life. And I think all of us wish you a happy new year, and hopefully we will not be having this conversation next year. So take care, everyone, be safe and be well, and have a very happy holiday.